The ScoliSMART exercise program is the first scoliosis treatment option to use neurobiochemical support principles in combination with both static and dynamic auto-response training. Recent clinical studies have shown certain brain chemical imbalances in scoliosis patients. These neurotransmitters are directly related to your spine's reflex control mechanism, which affects your spine's alignment. Our doctors test these neurotransmitters and provide supplementation to support, rebalance, and prevent spinal fatigue during exercises. Neurotransmitter monitoring in combination with auto-response training create a unique environment for positively influencing these reflexes and reducing your scoliosis. Stimulus response training, also known as auto-response training, is performed using specialized equipment such as the torso trainer, scoliosis cantilever, and the patented scoliosis activity suit. The use of ScoliSMART exercises is what really sets us apart. ScoliSMART exercises are based on the spine's reflexes and subconscious brain control. Like the beating of your heart, the alignment of your spinal column is controlled by your central nervous system. Like your heartbeat, your spinal alignment cannot be directly controlled by you. We can, however, indirectly influence this control mechanism by stimulating a reaction. Our doctors use innovative exercise equipment that engages the muscles that influence your spine's alignment. This equipment creates a stimulus via force that influences how the brain contracts your spine's deep muscle layers which control alignment. The patient does not think about which muscles to contract, rather the subconscious brain automatically does it for you. This is known as stimulus response training. If you were to run up a flight of stairs, stimulus, your heart would automatically increase its rate in order to produce more blood flow, response. It is an autonomic reflex that increases the heart rate. We use the same principle to stimulate the spinal reflexes, so the response causes more symmetrical muscle firing, which produces a straighter spine. We use two types of ScoliSMART exercises, dynamic with movement and static without movement. Your spinal reflexes are constantly controlling your spine's alignment and stability when sitting, standing, or walking. There are different muscles that are firing in a sequence during each of these actions. The static ScoliSMART training is performed standing while balancing on a vestibular disc using specialized cantilevers that create forces on the head, torso, or pelvis, which in turn cause a corrective response by the spinal reflexes that shrink the scoliosis. The dynamic ScoliSMART training is performed while walking, wearing a specialized scoliosis activity suit, which is a neoprene suit that creates torque forces. The torque forces then stimulate the suit, which creates spinal reflexes to then shrink the scoliosis. The use of neurotransmitter testing enhances our understanding of when these spinal reflexes are weak and fatiguing. By creating a custom supplementation program, we can help strengthen the spinal reflexes, which in turn lead to a stronger response and better reduction in stability of your scoliosis.